Good afternoon, everybody. My name is Salsabila Dewi, and I'm responsible for first aid responder. The purpose of my presentation today is how to do first aid. If you have any question you'd like to ask, please leave them until the end, when I'll be happy to answer them. In today's presentation, I'd like to cover 3 points. Firstly, what is first aid, secondly, early recognition, and finally, treatment of the victim. I just like to give you some background information about first aid. Now let's take a look at what is first aid. Providing immediate assistance to a sick or injured person and initial treatment until future and more complete treatment can be given from First Aid Guidelines 3rd edition. Immediate assistance given to a sick or injured person until professional help arrives. First aid is not only given for physical injury or illness, but also initial care such as psychosocial support from people who experience emotional stress due to experiencing or witnessing a traumatic event from IVRC First Aid Guideline 2016. Turning to purpose, first aid purpose: save the sufferer's life, prevent disability, provide comfort, and support the healing process. Right, let's move on to who can be called a helper. Lay person who does not have special knowledge or expertise in a particular field. First aid practitioner must maintain the safety of self, team, people around, and sufferers, can reach victim, can recognize and resolve life-threatening problems, provide assistance quickly and appropriately based on the victim condition, request assistance or referrals, communicate with other officers involved, trained personnel. That's all I have to say about what is first aid. Before I start, does anyone know about early recognition? Now let's take a look at primary assessment. In Indonesia, we say 3A, aman diri or save yourself, aman lingkungan or save environment, aman korban or save victim. If one of the above aspects cannot be implemented, then we can call for help. Next, response check. I'll learn whether the victim is conscious or unconscious. Voice, we can call the victim like, "Sir, can you hear my voice?" Pain, can express the pain point on the nails, under the nose and chest of the victim. Unresponsive, we can pat the victim's shoulder or check quite hard while calling the victim, as the example of the voice. I'd now like to look at respiratory assessment. Make sure the airway is open if the patient is conscious. We can assess breathing as below: chest rise and fall, increase respiratory effort. Cyanosis, or medical term for a condition where the skin lips and nails turn blue or bluish due to the lack of oxygen in the blood. Change in level of consciousness, respiratory rate. If the patient is unconscious, we can open the airway by pressing the victim's forehead and pressing the victim's chin simultaneously to see if there is blockage in the airway. Besides that, we also have to look at the nostril to make sure there is no bleeding that can block the airway. Don't forget to assess the circulation of the victim. Plus, next, physical examination. Change in shape, open wound, pressure, pain, swelling, so that an overview of early recognition. As you are all aware, moving on the next part, I'd like to explain about treatment of victim. Bleeding, the release of blood from blood vessels. Bleeding is divided into two, namely outside and inside the body. To treat external bleeding, press the wound area with sterile gauze or cloth. If blood is still seeping, you can add gauze and bandage it using sterile gauze. While doing this, make sure the bleeding point is higher than the hurt, which can help stop the bleeding so that the victim does not get tired of holding his hand. A sling can be made on his hand. Immediately take the victim for further treatment. For the treatment of internal bleeding, lay the patient down, check and maintain air breathing circulation, check the airway and pulse regularly. Do not give food or drink immediately to take a health facility. Next step 1. Do not pull the embedded object. If it has been pulled out, insert a cloth of gauze into the wound to help stop the bleeding. Make a donut, then attack into the surface of the skin and the object so that the object does not move, which can make the wound whether that's using roller, gauze, take to health facility for future treatment. This leads me to my next point, which is fracture. Fractures are divided into two, namely open and closed. Treatment for open fracture: make a donut and place it on the protruding bone. Rub the edge of the donut so that it does not move. Do a split using a split. If not available, you can use wood or long ruler. And mitella can be replaced with clothes, hand scarves, and dry via rope. Take to health facility for future treatment. If the fracture is closed, immediately perform a split and take to the health facility for future treatment. Now let's move on to fainting and asthma. Fainting occurs because blood circulation to the brain is reduced. How to do handle? Take the victim to a shady place. Check consciousness by beating the victim's shoulder or check. Positioning the victim lying on their back. Raise the victim's legs 15 until 30 cm. Loosens the victim's clothes. Apply fragrance such as eucalyptus oil to the chest, palms, soles of the feet, and nose to stimulate the victim to regain consciousness. Asthma is a long-term or chronic disease of the respiratory tract characterized by inflammation or narrowing of the respiratory tract that cause shortness of breath or difficulty breathing. How to handle it? Calm the victim, because if the victim panics, it will be difficult to breathe. Do not do the 4-second breathing technique. Inhale, 7-second hold breath, 8-second exhale. Maintain the airway, give oxygen or inhaler medication if necessary. Well, I've told you about treatment of victim. That brings me to the end of my presentation. Thanks for listening. In conclusion, first aid is critical life-saving skill that everyone should understand. It empowers people to act quickly and responsibly in emergencies, protecting life, reducing harm, and improving recovery outcomes. Early recognition of danger and proper treatment technique are essential steps in ensuring that victims receive the best possible care before professional help arrives. So to summarize the main point of my talk, first aid is the immediate help given to someone who is sick or injured before a professional medical care arrives. Its main goals are to save lives, prevent worsening condition, and provide comfort. Anyone can be a helper if they act safely and correctly. Early recognition involves checking for danger, victim response, breathing, and circulation. Basic treatment includes stopping bleeding, handling fracture, managing fainting, and helping with asthma attack. First aid is an essential skill that can make a big difference in emergencies. Finally, I'd like to finish by thanking you all for your attention. If anyone has any question, please feel free to ask them, and I do my best to answer. Thank you.